Clinical studies show that women who ignore their intimate health after 50 are twice as likely to suffer insomnia, low mood, and painful dryness. Yet the truth is, your body never loses its ability to respond, it only needs the right care. In this video, I'll reveal 6 science-backed methods that can reignite intimacy in your golden years without fear or shame. My name is Dr. Eliza Hart, a board-certified gynecologist with over 15 years of experience guiding women through menopause and intimate health after 50. What I share with you today comes directly from clinical practice and science, designed to support women in their golden years. Unfortunately, too many women are told to just accept it, to believe intimacy is over after menopause. But modern medicine proves otherwise. Yes, hormonal shifts reduce estrogen, circulation slows, and tissues become thinner, but these challenges can be managed. Addressing them not only restores intimacy, it also improves sleep mood and long-term vitality. That is why in today's video, I'll walk you through 6 clinically safe at-home strategies that every woman over 50 should know. And stay with me until the end, because method number 5 is often overlooked, yet it has transformed the confidence of many of my patients. Before we dive in, make sure you subscribe and tap the notification bell so you never miss practical guidance designed for women in their golden years. And I'd love to hear from you if you believe intimacy still matters after 50. Type yes in the comments. If you've ever been told to give it up, type no. Your voice matters here. 1. Your own hands, the safest starting point. When women first ask me, "Doctor, is it wrong that I still touch myself?" At my age, I can see the hesitation in their eyes. This hesitation comes not from lack of curiosity, but from years of being told that intimacy after menopause is somehow inappropriate or shameful. Let me be absolutely clear. Your own hands remain one of the safest, most natural, and most reliable ways to reconnect with your body. They have been with you in every stage of life, and they continue to provide comfort, calm, and yes, pleasure when guided with care. From a medical standpoint, the act of self-touch activates nerve endings that remain fully functional well beyond menopause. These nerves send signals to the brain that trigger the release of dopamine and endorphins, 2 natural chemicals that elevate mood, reduce stress, and even help regulate sleep. Studies published in journals on women's health confirm that regular, intimate self-care is linked to lower levels of anxiety and improved quality of rest, which is critical for women in their 50s, 60s, and beyond. In other words, what many dismiss as unnecessary is actually a simple tool for supporting both mental and physical health. Yet biology also changes with age. Falling estrogen levels can cause tissues to become thinner and drier, which sometimes turns what used to feel comfortable into irritation. This is where a small adjustment makes all the difference. A water-based lubricant. Just a drop or 2 restores glide, reduces friction, and prevents micro tears in delicate tissue. It transforms the experience from discomfort to ease, and from hesitation to confidence. Think of it as a form of preventive care, no different from moisturizing your skin or protecting your joints. But there is a deeper layer here. Allowing yourself to explore your own body is not about rushing to an outcome. It is about reinforcing the belief that you are still worthy of attention and tenderness. Taking a few quiet minutes, breathing steadily, and letting your hands move with patience can remind you that intimacy is not bound to youth, but to self-awareness. And while your own hands remain a trusted starting point, some women eventually wonder if relying on them alone becomes too predictable. That question, which I hear often in my practice, leads us into a more complex discussion about safety and the choices many women consider when seeking novelty at home. 2. Why household objects should never be an option. Every so often, a patient will lower her voice and admit that she has experimented with something she found in her kitchen or bedside drawer. At first, it may seem harmless. After all, these are objects we use every day. But what is ordinary for cooking or cleaning becomes highly unsafe when placed against fragile postmenopausal tissue. This is not a matter of embarrassment or morality. It is a matter of biology and infection risk. Household items such as vegetables, bottles, or improvised substitutes are not designed to meet the standards of medical safety. Surfaces may look clean, but under a microscope, they harbor bacteria, fungi, or chemical residues that are impossible to eliminate completely. According to clinical reports, older women are already more prone to urinary tract infections and vaginal inflammation due to declining estrogen and reduced immunity. Introducing contaminated or abrasive objects only multiplies the risk. Even a small tear in delicate tissue can open the door to a painful infection, requiring antibiotics, or in severe cases, hospitalization. Beyond infection, there is also the issue of mechanical injury. Hard or irregular surfaces can cause microcuts that are not immediately visible, but which lead to soreness, bleeding, or long-term sensitivity. At a younger age, tissues often repair quickly. After menopause, however, reduced collagen and blood supply mean healing takes longer and damage can persist. This is why what may appear to be a quick experiment can turn into weeks of discomfort and medical treatment. In addition, residues from pesticides, detergents, or cleaning agents can alter vaginal pH, disrupt healthy bacteria, and trigger irritation far more easily than most women expect. I always remind my patients that their bodies are not experimental grounds. Choosing unsafe objects is not a sign of curiosity gone wrong. It is simply a response to shame and lack of information. Many women feel too embarrassed to purchase a product designed specifically for intimacy, so they reach for whatever is nearby. But I tell them protecting your health and dignity is far more important than avoiding a moment of embarrassment at the store or online. Rejecting unsafe objects is not about limiting your choices. It is about safeguarding your future comfort. When women realize this, they often ask me, then what can I use that feels safe and still provides relaxation? The answer, surprisingly, can be found in one of the most ordinary routines of daily life, a place you already step into every evening without fear or judgment. 3. The gentle power of warm water. One of the simplest yet most overlooked methods of supporting intimacy after 50 lies in something almost every woman does daily, stepping into a shower. I often remind my patients that water itself can become a tool for healing, provided it is used with intention. For women navigating the hormonal changes of midlife, this practice is more than comfort. It is physiology at work. When warm water flows over the body, it stimulates the parasympathetic nervous system, which is responsible for relaxation and recovery. This activation lowers cortisol, the stress hormone that often rises with age and menopause, contributing to fatigue, poor sleep, and heightened tension. Directing a steady, gentle stream toward the pelvic area not only relieves muscular tightness, but also increases local blood flow, supporting lubrication and natural responsiveness. In clinical settings, hydrotherapy has long been recommended for muscle relaxation, and in this context, it serves the same purpose for intimate health. The key is moderation. Extremely hot water or high pressure can irritate sensitive postmenopausal tissue, which is thinner and slower to repair than it once was. A balanced approach around 10 to 15 minutes of warm, comfortable flow is enough to promote relaxation without risk. Afterwards, it is wise to pat the skin dry, gently wear breathable fabrics, and allow the body to settle into the calm that follows. I have seen women who thought intimacy was behind them rediscover a sense of ease simply by incorporating this ritual into their nightly routine. For many, it becomes not just a means of physical care, but also a mental reset, easing anxiety and preparing the body for deeper rest. The beauty of this approach is its accessibility: no embarrassment, no equipment, and no expense. Just the thoughtful use of something already present in every home. If pelvic floor discomfort is present, alternate brief seated breaks, and avoid directing water internally. External use only protects natural pH and preserves beneficial lactobacilli that help defend against irritation and recurrent infections. Before I move forward, I'd love to hear from you. Have you ever noticed that a warm shower helps you release tension or improves your sleep? Share your experience in the comments. Your voice might reassure another woman who silently wonders if she is the only one feeling this way. And as helpful as water can be, some women still search for something softer, something that brings both comfort and intimacy without introducing risk. That brings us to the next method, one rooted in familiarity, yet often underestimated. 4. Finding comfort in something familiar. It may surprise you, but one of the most practical ways to restore comfort and connection does not come from a clinic or a device, but from something already present in almost every bedroom: a pillow. When women describe feelings of tension, dryness, or loss of sensitivity, I often remind them that safe, soft pressure against the body can be both therapeutic and reassuring. A pillow is not just an object of rest. In the context of post-menopausal intimacy, it can become a tool for gentle stimulation without fear of injury. From a clinical perspective, the explanation is straightforward. Applying mild pressure to the pelvic region encourages blood flow and increases oxygen delivery to tissues that often become less vascular with age. This boost in circulation reduces stiffness and enhances responsiveness. Because the surface is soft, the risk of friction-induced irritation is far lower compared with hard or irregular objects. For women who struggle with vaginal dryness, even modest cushioning can make movement more comfortable, reducing anxiety about discomfort and encouraging relaxation. There is also a neurological benefit. The act of hugging or pressing against a soft surface engages sensory receptors that signal safety and calm to the brain. This feedback lowers sympathetic nervous activity, which is often heightened in women dealing with stress, anxiety, or hormonal imbalance. Lower sympathetic activity means less muscle tightness, steadier breathing, and greater capacity to feel pleasure without pain. In many ways, using a pillow mirrors the therapeutic principles of pressure therapy used for anxiety or sleep disorders, only adapted here for intimate wellness. Practical adjustments matter. Using a clean pillow with a smooth, breathable cover minimizes skin irritation. Placing the pillow between the thighs beneath the hips, or simply holding it close to the chest, allows flexibility depending on comfort levels. These positions do not require complex instruction, only patience and curiosity. Over time, women often find that what began as a simple experiment becomes part of a calming evening ritual. Now, I'd like to hear your perspective. Do you believe everyday items like a pillow can have unexpected health benefits when used thoughtfully? Share your thoughts below. Your comment might help another woman look at ordinary things in a new way. Still, as effective as soft pressure can be, some women eventually seek more targeted solutions, especially when natural changes in hormone levels make it difficult to achieve the response they once had. That is where modern technology offers an alternative designed specifically for female health. 5. Modern devices designed for women's health. For many women, the idea of using a device for intimacy feels intimidating at first. Some imagine it is only meant for younger women, while others fear that it signals weakness or dependency. In truth, the opposite is true. Medical-grade intimate devices are specifically engineered to support women in midlife and beyond, where natural hormone changes can make arousal slower and tissues more delicate. Far from being indulgent, they serve as therapeutic tools that address both physical and psychological needs. The science is clear. As estrogen levels fall, vaginal tissue becomes thinner and less elastic, while blood flow to the pelvic area decreases. This combination often leads to dryness, discomfort, and longer response times. Devices designed for women's health use gentle vibrations or pulsations to stimulate nerve endings consistently, something that hands or soft surfaces may not always achieve. Clinical research, including studies published in the Journal of Sexual Medicine, shows that regular use of these devices can improve tissue elasticity, enhance blood circulation, and restore natural responsiveness. In some cases, women even report reduced urinary symptoms as improved circulation strengthens surrounding muscles. From a practical standpoint, safety is critical. Reputable products are made from hypoallergenic medical-grade silicone and designed to be easy to clean, which drastically lowers the risk of infection compared with improvised household items. Starting with the lowest settings and gradually adjusting allows women to explore comfortably without overwhelming sensation. For many, this approach not only improves physical intimacy, but also helps rebuild confidence, making it easier to reconnect with a partner when desired. Equally important is the emotional impact. Women who once felt invisible or disconnected often rediscover a sense of vitality and self-worth when they give themselves permission to use these tools. In my practice, I have witnessed countless moments where a woman's entire outlook shifted after realizing that pleasure is not confined to youth, it is a lifelong right. I'd like to know your opinion. Do you think devices made for women's health should be spoken about more openly, or do you feel they remain too stigmatized? Leave your thoughts below. Your perspective may help normalize conversations that many women are still too hesitant to start. While modern technology can be empowering, not every solution requires innovation. Sometimes even the most ordinary structures in your home can serve as unexpected sources of gentle support when used wisely. 6. Exploring gentle pressure with everyday surfaces. Occasionally, patients tell me that even after trying safer methods, they still look for something different, something spontaneous that doesn't require planning or special tools. In those conversations, I emphasize that curiosity is natural and valid, but it must be paired with safety. Surprisingly, certain everyday surfaces such as the edge of a bed, a sturdy chair, or a cushioned armrest can provide the kind of firm but controlled pressure that stimulates blood flow and activates nerve endings. Used thoughtfully, they can be another option in maintaining intimacy at home. The science is straightforward. Pressure applied to sensitive regions increases circulation, which in turn improves oxygen delivery and enhances tissue responsiveness. This type of stimulation can help offset the reduced vascularity that comes with menopause. However, unlike medical devices or soft pillows, these surfaces are rigid, which means the risk of irritation or bruising is higher if women are not cautious. Because postmenopausal tissue is thinner and bone density may also be reduced, it is important to place a folded blanket towel or cushion between the body and the surface to distribute weight evenly. Another point to consider is musculoskeletal health. Many women in their 50s and 60s experience joint stiffness or lower back discomfort. Leaning heavily against a hard surface without support can worsen these symptoms. Adjusting posture, choosing positions that protect the hips and spine, and listening to the body's signals are all part of practicing safe intimacy at this stage of life. From a psychological perspective, the value of this method lies in its immediacy. There is no need for preparation, no purchase to justify, and no external judgment. The environment itself becomes a reminder that intimacy can be woven into daily life without ceremony. For some women, this spontaneity restores a sense of playfulness that had been missing for years. Now I'd like to invite you to share your thoughts. Do you think everyday settings can influence how comfortable or confident you feel about intimacy? Your reflections might encourage others to look at their homes with fresh eyes, seeing not just routine furniture, but potential sources of reassurance. Still, while surfaces can provide variety, the larger message is that intimacy after 50 is not about methods alone. It is about honoring health, embracing confidence, and recognizing that pleasure continues to be a vital part of life, a theme we will return to as we conclude this discussion. Begin by choosing a calm, predictable window of time, ideally in the evening, when cortisol naturally tapers and the nervous system is more receptive to relaxation. A warm shower first can prime circulation and reduce pelvic floor guarding. Limit water to external use only and finish by patting dry to preserve the skin barrier. If dryness has been an issue, keep a small bottle of water-based lubricant within reach and use the smallest effective amount to restore glide without disrupting vaginal pH. Start modestly with 5 to 10 minutes, 2 to 3 nights per week, focusing on comfort rather than outcome. With the hands, think of mapping sensation rather than pressing for intensity. Slow, consistent touch provides clearer feedback to the brain and avoids overstimulation. If you prefer soft pressure position, a clean pillow with a smooth, breathable cover beneath the hips or between the thighs, adjusting height until the lower back feels supported and the pelvic floor can relax without strain. For women with hip or lumbar sensitivity, a folded towel under the sacrum can offload joints and keep the spine neutral. If you are considering a medical-grade device, verify hypoallergenic silicone and a sealed, non-porous surface that cleans easily with mild, unscented soap and water. Begin at the lowest setting and test responsiveness over several sessions before increasing intensity. Tissues adapt over time and gradual progression reduces the likelihood of irritation. Limit early sessions to 10 minutes, extend rest days if tenderness appears, and avoid internal use if there is active infection, unexplained bleeding, or recent pelvic surgery unless cleared by your clinician. When using firm household surfaces for external pressure, always add a protective layer, a folded blanket or towel, to distribute load and protect thinner postmenopausal tissue. Maintain positions that spare the hips and lower back, and change angles if numbness or joint discomfort develops. Throughout any method, coordinate slow nasal breathing with longer exhales to downshift sympathetic drive. This quiets pelvic floor co-contraction and often improves natural responsiveness. Track what helps by keeping brief notes, time of day, method used, comfort level, lubrication needs, and sleep quality that night. Seek medical advice if burning, bleeding, fever, or urinary symptoms occur, and consider tailored support such as topical estrogen, pelvic floor therapy, or treatment of dermatologic conditions when appropriate. The goal is not intensity, but repeatable comfort and confidence. Small, consistent steps compound into meaningful change. Now that you have a clear, safe framework to apply at home, let's bring these insights together and close with the larger medical message that ties intimacy to overall health and vitality. As we close, let's bring these 6 strategies back into focus. Each of them, from the simplicity of your own hands to the safety of medical-grade devices to everyday comforts like a pillow or warm water, is not about indulgence, but about health. They exist to support circulation, hormone balance, emotional stability, and above all, dignity in the years after 50. Clinical data and decades of experience confirm that intimacy does not disappear with menopause. What changes are the conditions of the body. Estrogen declines, tissues thin, and responses become slower. Ignoring these changes increases discomfort and health risks. Addressing them with safe, intentional practices restores sleep, reduces anxiety, and helps women feel whole again. Intimacy, when reframed this way, is as important as exercise or balanced nutrition. My advice is simple. Choose one method that feels approachable. Begin gently and observe how your body responds. Consistency matters more than intensity. If something causes pain, stop and seek medical guidance, but never assume that aging means giving up this vital part of yourself. By respecting your body and listening to its signals, you not only preserve intimacy, but also protect your broader well-being. Thank you for joining me in this conversation. If today's guidance offered clarity or reassurance, I encourage you to share your reflections in the comments. Your experience could inspire another woman to step forward with confidence. And if you found value here, please share this video together. We can normalize healthy, empowered intimacy at every age.